today. I don't know about yourself, but I've been feeling so good. I'm feeling the vibes today. I'm so grateful that I'm alive. Yeah. Of all this going around as this pandemic, and if I'm strong and if I'm beautiful and if I am alive, I should be able to happy myself. So yeah, I'm happy even though I'm very tired today. I've been literally working since this morning, but hey, I had to scoop up time to do this video for my valued and lovely people. Yeah, today we are going to be looking at what we need in our hospital bag. Hey, pregnant women, I know, should not carry heavy bags, but hey, when it's time for packing our hospital bag, people want to pack their whole house, you know. I did that in my first pregnancy. So from experience, I'm going to be guiding you to know the essential things that you should have in your hospital bag. Let's begin. All right, so to begin with, you will obviously need your hospital bag. So this is my hospital bag. I use it for my first pregnancy and second as well. I love this bag so much. It's lightweight. It has a handle here, so if you want to pull it and drag it, it has ties underneath it as well. Okay, and it has another pocket here, very spacious and very portable. So this is what I normally use, and it is my hospital bag for today. Okay, so let's get packing. Okay, so I start with my toiletries. So toiletries are basically things we use in our day-to-day and every day. Okay, starting from the bathroom. Yes, I have my piece of towel. I normally go for a bit bigger one that I can wrap around myself in case I have to. So, and then I go for my cute sponge. So let's keep packing into the hospital bag. Okay, whatever you take for yourself, you take same for precious baby. So baby, normally I go for this small face towels. Okay, I take that because normally you don't really bath them there. Even the first time the nurses may bath them for you, but from there you're not going to bath them until you come back home. So I take these ones, use it to clean them every morning and evening. So one for maybe cleaning it with the soap, and then I will have another one for drying the skin. Okay, so and then I have one more extra. So normally I take 3 to 4 pieces of this to take care of the baby. Okay, and then sometimes I come with the sponge. Okay, sponge comes in so many shapes, so anyone that you're okay with. I got this from Savers. Okay, and it was just 50p for the pack. So that's for baby. Okay, that goes into a hospital bag. All right, now we'll look at our PEP students. You have to brush your teeth and I will put them in plastic bags so that it feels more organized. So on this one, I have my toothbrush and paste. Okay, I have my deodorants. I got my deodorants as well, so you get your deodorants. I got, importantly, the soap. Somebody say, that's so small. Yes, I don't see the essence of carrying a big soap to the hospital, but sometimes they even provide one for you, and you're going to spend max of like 3-4 days. Okay, if you had vaginal birth and it's normal, the maximum you might stay in the hospital is 2 days. If you go through C-section, the maximum you might stay in the hospital is 3 to 4 days. Hey, this should be enough for you and baby. So I went for that baby, which I'm going to be using it by myself and baby. Okay, and then I have my brush to brush my hair and maybe hold it up or whatever I need it for. So that is it for the bathroom and then the shower. Okay, I also have my body cream for myself and the body cream for baby. Very important, because when they come, their skin tends to be very dry, so they need get the ones that has a lot of moisture in it, because it's going to help. People normally go for that, or we have other ones like the coconut oils and the vino, but I normally, my skin like goes properly with that, and that's same with my first son. So with the second one, I decided to go for the same Moving from that, we're going to look at our sleeping suit, or I'll say bedding. Okay, what do you use in sleeping? For me, the first baby, I did pack blankets and some pillows and took it to the hospital. But let's be frank, like, I didn't use them because the hospital provided that for me as well. I didn't use them. I actually had a small cabinet by my bed where I had a lot of sheets being packed in. And as much as I requested for pillows, they always gave me. So I don't see it important packing it this time around. But for baby, it's important because, you know, babies are in the womb and they be in the womb. They feel cozy and comfy. So when they come out, you have to let them feel the same way. Either than that, they're going to be crying all night, disturbing you whilst you are in pain. So with baby, yes, I got some blanket for the baby. Very, very cozy and soft. I love this blanket. I got them from Amazon. Yes, I got them from Amazon. It has this inscription on it. Says Mimi's Young or something like that. And I got the white one from Matma company. That's matma.co.uk. Yet it has also the same thing called the Mimi Young, but however, it feels the same. It's very soft. So I'll use one to cushion the bed, okay, make the bed feel more comfy, and then this one will wrap around the baby, make it feel more cozy, more comfy, more comfortable. Yes, so that is it for the baby. Now let's look at what we'll be wearing to sleep. Of course, we need to be comfortable when we are sleeping. So I have my nightwear, beautiful one here. I got this from Boohoo. I love this lace. Okay, yeah, I got this from Boohoo. I got my morning coats because sometimes the weather is a bit cold, you need morning coat to cover up. So I got one morning coat. Let's put it in there so I don't forget it. I like putting on shorts a lot, so I got this lovely shorts with a top. Okay, I'm going to be using that as well. I would advise, when it comes to your sleeping suit, you're not going to spend more than 3 nights there, so you determine what you want. You can choose to take 2 or 3 sleeping nighties or nightwears. Okay, it's up to you. Okay, with baby, I got a sleep suit for baby. So yep, I got this from Nest. I love Nest. Their things are so comfy. Like, the material is good, like I don't know if it's cotton or whatever, but it feels so comfy and it's quality. You know, some of the things, when you buy them and you wash them in the machine, after 1 or 2 washes, it goes like bad. But this one, their things are good. I get most of my baby stuff from Nest. So this is a comfortable sleep suit. I loved this overall because when baby comes, it's not now you're going to be bothering baby about socks, about that. This is just one raw thing and the baby's in and comfy and sleeping. Yeah, so I got this for baby. Good. And then with my hair, I need to cover up. I love using either a scarf or a bonnet. Hey, this is my favorite hair bonnet in this house. I know when I took it, my husband was like, why didn't you take the other? I was like, no, I'm going with my favorite so that I can be in a happy mood. I love this bonnet. Like, apart from its color and everything, it feels soft to the skin. You can actually wear it in and out. Look at that. Amazing. And I had this from Slay Fashions. Slave fashion is very, very affordable. Very, like, it's cheaper for its quality and its value, you know. And yeah, I love it. I got it from Slave Fashion. So shout out to Slave Fashions. I love your bonnets. Yeah. And this is not sponsored. Trust me. I just love it, and I have to testify and share with other moms. It's very comfy. It doesn't slip off your head when you use it. And it's actually, yeah, I've washed it for like 4 or 5 times. And it still looks the same and looks new for me to take it to the hospital, of course. So this is it for my hair for sleeping. Now, all this and done, let's look at our feeding essentials that we need to take to the hospital. Feeding. Moving to feeding, one essential thing that you should consider is your nursing bra. Okay, I normally go for these ones. I get this wonderful bra from matma.co.uk. I love their bra. In my first pregnancy, I used their bra. It was really, really supportive. It's very, you know what, like they have, I don't know if you can see, hooks here for you to adjust as you increase. You know, when you are breastfeeding, size tend to be fluctuating a lot. Okay, so it's very helpful. They have a solid hands as well. And what I love about it is there was just this click here to just open up and feed baby, and then just a click back on to feed baby, to unfeed baby, sorry. All right, so they have it in the cotton and they have it in the nylon. They're all the same, the kind of quality. I love the nylon because I can really sleep with it. Very, very soft and comfy. Yep. And the cotton is a bit heavier, but they are all very good. Wash it with your hand, you wash it in the machine, it still stays the same. So I got 3 of that. They have it in different colors. They have that color I love so much, the black, and I got it in the gray as well. Yeah, so that is my maternity bra packed. Okay, and of course, if you think of maternity bra, the next thing you should be thinking about, it's your breast pads. Okay, I normally use this from Philips. I love theirs. It's the disposable ones. Okay, I tend to love the disposable ones, especially within my first pregnancy, because I thought that was more hygienic. Okay, but now with experience, the thought has changed, and I'll tell you why. But before that, you don't need the whole box to take to the hospital, because most of the time when you deliver, your breast don't tend to start flowing. Okay, sometimes it even takes about a day or 2 before it starts, and when it starts, it's not going to be coming so much, so you don't need so much of this pack. So normally I'll take like 10 pieces, because you don't actually need more than 3 per day. Okay, so I'm going to be taking just this few to take along. I would rather put it by the side here, easy access. Okay, so back to what I was going to talk about, that my experience, based on my experience, my thoughts has changes. This is the disposable ones. Okay, I had this one also from matma.co.uk. I love their product. Like, it's affordable, it's cheap, but it's very quality. And I went to read a bit about them, and I understood that it's actually experienced moms coming together and through like problems that we face in maternity, they're actually trying to bring product out that is solution based. I don't know how true it is, but I've read that on the internet. All right, so I love the disposable ones now, because first I thought it wasn't hygienic, that at least the disposable ones could be used and thrown off. Okay, but I love these ones because when it gets wet, and you're trying to touch it, this place is waterproof, so your hand don't touch the mess and it feels more comfortable touching it. Whereas the disposable ones, like this ones, when it gets wet and you touch it, you feel it everywhere. Another disadvantage I don't like about this is once it gets moved from the bra, it doesn't stick again, so it tends to be like folding around it instead of it covering the nipple to absorb it. Okay, but with these ones, it's big and wide enough. It gets there, you can push it up and down the way you want it. But that's my own opinion. So I'll take 10 pieces of this one to the hospital, and of course I'll pack 5 of this as well to the hospital. You might not need that much, as I said, because your milk might not be flowing, but I tend to start flowing straight after delivery. Yes, so I will need a bit of much of these things. Okay, so yeah, that being packed, now let's look at the feeding side for the baby. Okay, so most of the time I go with these. Okay, so this is formula. We have different types of formula. This is Cow and Gate. We have Aptamil. We have SMS, a whole lot. You go with what you think you prefer. I tried the Aptamil for my first baby. It didn't work, and she loved the Cow and Gate, so I'm doing Cow and Gate for this one as well. So this one comes in this box, and it comes with a tit on it, a little tit on it. Okay, so with this one, you don't normally need a feeding bottle in your first 3 days of being in the hospital. You can start using a feeding bottle when you come back home. However, I tend to still take a feeding bottle there, because from my first experience, when the baby drinks from this bottle and there is a remaining, the baby doesn't consume it within the next hour, it's contaminated. You can't use it again. So like, you waste that food. Whereas when I bring it along, okay, if I bring the feeding bottle along, I'll be able to divide the content, okay. Just give half of it into the feeding bottle and feed the baby with it. And that half left can be used after 2 hours, compared to it being the same bottle and you cannot use after 1 hour. Okay, so it's just saving. All right, so I have that put in my hospital bag. Sometimes I get extra of the Cow and Gate, and as I said, the feeding bottle, I always take the feeding bottle. This is a beautiful feeding bottle. I don't know if you can see it so clearly. They have the green, they have the pink. And the reason why I went for this was I was searching about colic. We all know, I don't know, if your first time mom, maybe something new to you. So colic is something that the children normally experience a lot for their first 3 months. Sometimes it's distressing, trust me. And I read a little bit about it, and I got to understand that, you know, with the old bottles that they used to have, the feeding bottles, it was normally like plastic and it was so hard. Okay, that's why sometimes babies tend to reject feeding bottles, because according to what I read, or according to research, babies touch it and they feel it's hard, and they see the difference between the mommy's breast and the feeding bottle. Okay, so they tend to reject it a lot. All right, and that one also had just one hole. They call it vent hole, air vent, yeah. And that means when the air goes in through that hole into that, and the baby feeds it, the air goes to stay in the baby's tummy, and then it makes the baby uncomfortable, and baby cries a lot. That is what we term as colic. But with these ones, it has 2 air vents. So one takes in the air, the other takes out the air. So there's no air being stuck into the bottle for baby to swallow into the tummy for it to cause that colic. So they call these bottles anti-colic. I don't know. I had this one from matsma.co.uk. Very affordable. I love it. And one thing I love about this bottle is, look at it. Can you see it? It's so soft. It's like mommy, it's like our breast. It turns like the breast. And my first baby loved it. We loved it. I remember I had to go back to work and she was just rejecting all the bottles. Somebody introduced me to it and I used it for her. She actually accepted it very easily, because when they touch it, they feel it like it's the breast, and then the tit is also like the breast shape. I don't know if you can see it very well. Yeah, so I love these bottles. They have it in sizes and in colors as well. So you can check. I'll put the link below in the description. You can check out with yourself. So as I said, I just empty some of the milk into this, feed the baby, and then I'll be able to keep the remaining for more than 2 hours, and still good for the baby to feed on. All right, then of course, not forgetting our most essential thing for the baby is our dummy. People call it pacifier, other calls it smoothers. Yes, so this is our dummy. I got it in 2 colors. I love this is the white and a stripe of green, and I have it in the red. And I got 2 because I don't know which one the baby is going to accept. I don't know if you know the difference. We have a tamed style and we have the orthodontic style. All right, so the orthodontic style is the one that has a round tip. Okay, is the tip is round. Okay, round like the breast. Okay, so it's very good. I heard the orthodontic is the ancient one, like the old type, and it helps with the mouth development as well. Okay, so it's very good for the baby to accept this. But however, some stubborn babies do not want to go with this one. Okay, so I got the round one, which is the orthodontic one. And then we have the tamed one. The tamed one has a flat side, one flat side and one round side. Okay, so that's the tamed style. And I love this one. It's so lightweight compared to the ones that is so big on the baby. The baby itself is tiny and cute. Come on, why would you pressure the baby with big dummies? This one is so small, lightweight and cute. And one thing I love about, let me put this thing down somewhere. One thing I love about this, it has a cover. And then with the cover, you know, see the hand, you just push it down like that, and there's a click, and it get locked. okay, it get locked. Okay, so baby cannot just easily pull it until they raise the handle out before it can come out. So it goes in that way and it get locked. Okay, and it doesn't fall off. I love it. I love it. I got this from Matma.co. I'll put the link below in the description. Okay, and then it comes in amazing container like a pack. I love this. It's so, I love cuties. Okay, with the cover, look at that. So cute, isn't it? So cute. I love it. And this is also good for sterilizing as well. You can sterilize it in it, which is amazing. All right, because the hospital, you don't have to leave these things all around. So this will be good for you to have in your hospital bag. All right, and of course we have our babes. I have 3 babes I took. I got this from Amazon. You can get it anywhere that you want. I normally take 3 of them. Don't need to pack a whole lot. Come on, baby's not going to be feeding. When they come in your first 3 days, they sleep a lot. So you wouldn't really need so much or so much of a babe. Just few of them. All right, so now finishing with that, let's look at the clothing side, what we need to go. I normally just take like 2 to 3 clothings to the hospital, okay? So I have that one. I got this from Amazon, just a straight dress, but the neck is kind of the spans. Okay, it's a span. So I got that one, that color, and the same style in this color as well. So that goes into my hospital bag. Good. And then I got this one. It's a top and down. One tip though that I would say to you, I would advise is when you get your clothing, make sure that you have the ones that is easy to get access to your breast. So for example, this one has some buttoning here. You can just open the buttoning and you get access to your breast. Okay. And you could see that the first one I put in the bag also was kind of, it expand, so it's easy for me to get access to the breast. Come on, it's about the baby, it's not about yourself. So try as much as possible that even though you go for your preference of color, the type of dress you want, make sure it gives you access, easy access to your breast for the baby to feed. So that is a little tip there for you. Okay, so that's done and go. Let's go to see my panties. Normally I don't take much panties, but I normally take this high waist panties. I got these high waist panties from Amazon as well. Yep, I normally love taking this because it holds your tummy in, everything in. You know, sometimes when after delivery everything seems to be scattered and you feel a bit like wholly into you. So this one tends to hold things in. I normally take just 2 because I don't spend much time in the hospital and I don't think I'm going to spend much this time around 2. And then I take normal panties as well, like normal panties in case of anything. Like I feel like doctor goes around and say don't put pressure on your tummy at the moment, then I'll have an option of panties to use. So I just take 2 to 3 panties extra to the platform. And then my favorite panties, I love these panties. Look at that. I know it looks embarrassing but hey, these are the best panties you can have. Why? Because it has the pad inserted into it. Okay, already inserted into it. It's so comfy. It's so comfy. Trust me. This is good for vagina delivery and it's good for C-sections as well. Yeah, with C-sections, when you wear it, you know where the scar is. This is so tender and soft, and then you can even put it like turn it over like that, and then it covers it and cushion it from like more air and that, because when you finish it, it's kind of more sensitive, and because it's kind of more sensitive, you would always want to cover it so that it doesn't hurt so much. So this is very good. It's disposable. Once you use it, you throw it off. And as well, we all know we need pad at that moment, and so this one becomes like a 2-in-1 thing, wearing that panty that is comfortable to cover your C-section and also having the pad inserted into it for the bleeding that we all have, whether vagina birth or C-section birth, we all bleed, so that helps as well. I normally get these from Sainsbury's and I love them. I love them. It's a must-have. You should get some, even though sometimes pads are provided by the hospital. Of course, this is a 2-in-1, so it's like more handy. Okay, so that comes all shut down for my items. Now let's look at the clothing for baby. You do not need to take too many clothing for baby. Of course, you don't need to, just few of them. So because the weather is getting a bit cold, I got some long sleeves. I just got like 4 of them for baby. Yep, you can get it anywhere, wherever preference you want. And of course, I've got some vests for baby. So I got some 2 vests for baby because the weather is going to be a bit cold. Hey, the exciting thing, look there. That's baby's name on the vest. She's going to be called Paris. Yeah. So that is my 2 vests for Paris going into the hospital bag. And of course, I got this sexy trousers or stretch or tight for Paris. Okay, yeah, I got this from Nest. I love Nest. I love buying children clothing from Nest. It's so quality, and I love them. So I got just this 4 for baby. So that is it for baby's clothing. All right, then I got this cutie. Can you see it? Cutie. There's a hat, a baby hat. Yes, I got this from matma.co.uk. I love this. Like, it looks so cute like that with the beautiful bow tie. Oh, so cute. So I got it in 3 colors. I got it in this blue and pink mixture, and I have it in plain pink and plain white. But I'm not taking all the 3. I'm just taking 2. Okay, you do not need to take a lot of things. Okay, and then I have the socks, baby socks. I got this from Matma as well, matma.co.uk. Cute normal socks for baby. I just take 2 of them. And then of course I have the gloves for baby. Look at how cute it looks. It looks so cute. It looks so cute. It looks so cute. And then I got some socks shoes for baby. I got this from the mother care. Yes, it was my previous baby had it, so that's for the baby. And of course normal gloves as well for baby. Cute, cutie, 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 cutie for baby, because baby needs to be cozy. As I said, they feel cozy in the womb. So if you want your baby to be happy and bubbly when they come out, you need to take everything that'll make them feel cozy. And of course, I have my Pampers here. You need to take Pampers. Some hospitals will give you, but I also prefer to take few of them. So sometimes I take 10 of them. If you're not sure of your baby's size, try as much as to get size 1 and size 0 and take both of them to the hospital. So in as much as the weight may vary, you still have an option to have one to use for them. So that goes into the hospital bags. And of course we have our wipes. Go for any wipes that you want, but I think 1 wipe or 2 max is enough to take to the hospital, and not more than 2 wipes. Okay, then most essential items is your painkillers. I'm telling you, trust me, whether vaginal birth or C-section, you need this painkillers. Okay, normally I take the paracetamol, that's the 500 mg, and then the ibuprofen 200 mg. Okay, sometimes the hospital gives you, but they don't normally give you as frequent as you want it. But however, if you take yours, whenever you're about to take it, try and tell the nurse who is on duty or the midwife taking care of you before you take these tablets. Okay, because they are monitoring how your system is getting back to normal. So try and let them know. And then the last but not the least is these. Okay, I think one of them is getting out of hand. Yep, this is what you will use anyway, the nail cutter. Okay, but most of the time the nurses tend to trim their nails for them anyway, because babies comes out with long nails. Okay, but if you don't want them to use theirs and you just want your own private one, it will be advisable to carry this small one. I got this from Savers. Okay, and then yeah, you are good to go to trim baby's nails. One last thing that I almost forgot was your bathroom slippers. Try and get one, but that's what you're going to be walking around. That one the hospital is not going to provide for you. So basically, this is all you need. This is all you need, trust me, to go to the hospital and back. All essentials that you need in your hospital bag. So our hospital bag is fully packed and ready to go for our yeah, and we are happy to go. Thank you so much for watching this video to the end. I hope I've been able to guide you to know the right items to take to the hospital. I'm always happy to bring you such videos. Please, as I always say, do not forget to share to help other moms. Hey, it's about moms helping moms to make motherhood joyous. We bring you this video every week. Comment below with things that you want us to film videos on. Let me know if there's something that I didn't mention and you think should be in a hospital bag. Let us know. Comment it below. Let other people also read it, that they can benefit from it. I'm always happy and excited to stop by, and I'm so thankful that you also stopped by to be part of this video. Like, share, and until another time, I will see you.